immigrant and refugee communities. I'll go into a little more detail about our resources for parents and how organizations around the country have successfully been working with youth. So then Rithi and Claudia will show you how you can use open source tools to help de-escalate the often polarized conversations that are taking place around COVID-19 vaccine among young people in RIM communities. And go on to the next slide and next slide. So just a little bit about us. Next slide. We are funded by the CDC and housed at the University of Minnesota. And we exist to support health departments and community organizations that have been working with refugee, immigrant, and migrant communities that have been disproportionately affected by COVID-19. We do this by strengthening partnerships between health departments and communities, and by supporting organizations that work directly with refugees, immigrants, and migrants. Next slide. We support organizations by collecting and disseminating best practices. We do health communications and health education, and by offering online trainings such as this. We also offer technical assistance and a few other services. So we have a number of other resources that support vaccine confidence in immigrant communities more generally. First, I'll let you know, next slide. We have a section of our website called Vaccine Central, and this has resources to support vaccine planning, rollout, knowledge, and confidence among refugees, immigrants, and migrants. This includes checklists and guides, as well as promising practices from around the country that you can replicate in your communities. Next slide. Now, what we're going to talk to you about in just a minute is no judgment, and that's all about having compassionate and non-judgmental conversations with others. So even before no judgment, we had conversation guides geared towards adult audiences. And these guides allow bilingual community leaders and staff at refugee resettlement agencies or community-based organizations to answer questions about COVID-19 vaccines and participate in these conversations with others. And we create these guides as new issues emerge, and we frame them around immigrant and refugee perspectives. Next slide. We also have 3 vaccine confidence campaigns. So the first one you see on the left is our Get Vaccinated campaign, and that's based on feedback we've gotten that says that people from many different backgrounds connect with the theme of protecting their communities. In the middle is a sample from our Get the Facts campaign, and that is based on CDC guidance, offering facts about COVID-19 vaccines in a simple and memorable way that counters common misconceptions. Now, these 2 campaigns are customizable with drag and drop templates. So if you want to remove our logo, change the URL, or use a more culturally affirming photo, we have templates available for you to do just that. Now, on the right is a sample from our Vaccination Is campaign, and that was created using a community-led hyper-local communication strategy that honors the priorities, the values, and the expertise of community leaders. And so Get Vaccinated and Get the Facts are effective if you need broadcast messaging that's universal at a large scale. But for a more targeted campaign, it's really important to partner with the communities themselves to learn what's going to work best. So with these 3 campaigns, you can easily conduct a mass communications campaign for your broader community, as well as develop targeted messaging for those who are hardest to reach. And we believe that both of these approaches are important for any vaccine campaign strategy. Next slide. Now, in this work, we heard from immigrant and refugee youth that involving their family in their decision-making was important, even among young adults. So we have a lot of resources with parents as an audience. Next slide. So first, we have a fact sheet on vaccines for children. This is translated into more than 40 languages and also includes key messages that are relevant in many immigrant communities, like that vaccines are how children stay safest and that vaccinated children protect the entire community. Next slide. We heard from our partners that fertility was a top concern among parents from RIM communities for themselves as well as for their children. So created a fact sheet. This is also in 40 languages, and that it incorporates perspectives that are common in many immigrant communities. For example, that the vaccine will help you stay strong and healthy so you can continue to provide for your family. It also notes that vaccinated parents protect their children both by preventing the children from being infected with COVID-19, but also because, for example, antibodies can be passed on to babies through breast milk. And so we really show that vaccines are safe before you have children, while you're pregnant and breastfeeding, and also for the children and youth themselves, all while showing, we have a lot of imagery that shows multiple generations. Next slide. So to continue with this theme of protecting the greater community, we have an animated short called Children Keep Our Communities Strong, which highlights the perspective of one immigrant mother as she explains why she chose to vaccinate her 2 children against COVID-19. And this video touches on themes like preserving their way of life, protecting future generations, and ensuring children can carry on family traditions. Now, this video is available in 14 languages total, and we're working on a sequel that tells the story from the perspective of the father. Next slide. So we learned that parents are particularly concerned about vaccine side effects for themselves and for their children. In many small communities, one person's negative experience with vaccine side effects can dissuade others from seeking out a vaccine. So as part of our Get the Facts campaign, we have social media assets, again, in more than 40 languages that address a number of issues, including details about side effects. Next slide. Now, No Judgment is all about working with youth, and we know that there are organizations across the country that have been working successfully with youth and young adults. Next slide. So many refugees, immigrants, and migrants serve as sort of a bridge between their communities and the broader US community. And within this bridging role, youth often take on more essential caregiving responsibilities for their families, in part due to their ability to learn English and navigate the US context more quickly. So engaging young people as COVID-19 ambassadors is an effective way to reach more youth and their families. Now, this is an example from Atlanta, Georgia. The International Rescue Committee there hired youth ambassadors to help them run vaccine and testing clinics and work on their health promotion efforts, both on social media and in person. And these youth ambassadors collectively speak more than 20 languages, and they help their communities overcome digital access and literacy barriers by answering questions around vaccine eligibility. They help schedule appointments and also arrange for transportation. The 3 people you see on the slide here, it's Tila, Christy, and Rubel. They actually helped us with the first stage of the No Judgment campaign, which you're going to hear about in just a minute. Next slide. Another successful strategy for communicating with youth is to encourage them to wear a mask or get vaccinated, not just for themselves, but for others. And so in doing this, you might highlight a community's cultural values, which could include solidarity or collective responsibility or reciprocity or duty to family, respect for elders, and other values that are consistent with taking action to protect others. And this is an example from Minnesota. Breva Health launched a video campaign called Who Are You Masking Up For? And this video shows a series of East African youth explaining who they're protecting by wearing a mask. Some of the young people who appear in this video they're established influencers within the community because of their work in music or local government, and others are just regular community youth. Next slide. So youth groups can be effective outreach partners by distributing resources and empowering the youth in the community to be active participants in the emergency health response. So when COVID-19 started spreading really rapidly in Kansas City, Advent Health Shawnee Mission relied on their refugee youth outreach group, which is called New Change for Youth, to engage their community. So with funding from the hospital system, they activated their youth volunteers during the COVID-19 response to actually go door to door and deliver education and resources to the community. And these youth volunteers even provided rare access to community elders. And so this partnership went both ways. The health system got their information to the community, and feedback from the youth helped the health system improve their response. Next slide. One way to build trust and promote vaccination efforts within communities is to meet people where they are. And so engaging communities at familiar and frequented event sites like sporting and routine athletic events is one strategy to remove some of the barriers to vaccination access that exist among communities. And so this is an example actually from Maine. the Northern Light Home Care and Hospice held 2 COVID-19 multi-age vaccine clinics in a public housing location where the community holds basketball games. And this is in a community that is mostly Latino youth. And so having the same familiar faces there every week helped them build trust with the youth. And then the basketball game organizer actually extended the season so that they were able to catch people who are running up on their second dose appointment times. Next slide. Finally, I'll share about K-12 schools. They really serve as community resources to assist students and families who are from RIM communities, and schools are already deeply rooted in these communities. They are uniquely positioned to bridge cultural and linguistic gaps for health departments because families are really used to receiving information about a range of topics from their schools. So schools can help with outreach and education about COVID-19 and COVID-19 vaccines. We know health departments are partnering with schools to provide services across the continuum of COVID-19 prevention and mitigation. This could include pop-up vaccine and testing sites, case invested in contact tracing practices, offering community-based interpreters, family liaisons, or social workers to offer support. Now, we have an example from Atlanta, again, from the Refugees Women's Network and the International Rescue Committee. They actually partnered with their local school district and health department to offer COVID-19 vaccine clinics in the schools. And they created a fun event with a superhero theme. And they've administered hundreds of vaccines since they started doing this in January. And if you're interested in learning more, I'm actually moderating a webinar with them later this month. The link there is going to be on your screen. Next slide. So I know I just gave you a lot of information, but the important thing is that everything I've just shared with you is really to help organizations and adults. And as we were looking at our health communications portfolio, we really didn't have anything that spoke directly to youth audiences. And so that's why we partnered with Ideaorg to create something completely new. So with that, I'll turn it over to my colleagues there, Riddhi, Claudia, and Ezgi, and they'll talk more about our No Judgment campaign.
Thank you so much, Sarita. As you mentioned, we'll share a few more resources that Idea.org team has created in collaboration with NRC RIM and also our community partners. But to start us off, I'll share a bit about Idea.org and how we work. So we are a nonprofit design studio, and our mission is to work alongside communities to design towards a more just and inclusive world. And our approach to do so is by using human-centered design, which simply means we center the people who will benefit from using those solutions themselves as key decision makers and influencers. And we definitely recognize that community-driven work is likely very familiar to this group. So just like your work, human-centered design and community-led design, community members are key to everything we do, not just at the start of the project when we're defining the problem or at the end for feedback, but they're the ultimate drivers, influencers, and the key decision makers on what we create. And actually, today we're honored to be joined by one of our co-designers, Marali, from our latest project, who she will share her experiences at the end of, after me in this webinar. So Marali and many other co-designers' experiences take many shapes and forms during the project. They range from surfacing the challenges and the needs they're facing to testing concepts in their communities. From being decision makers on what we ultimately create to co-creating strategies for rollout and implementation. Because we also believe that when it comes to sharing information, who is sharing the message is just as critical itself, like the message that we're sharing out. Our work engages leaders who have already built trust in their communities to serve as messengers, just like Marali was. Next slide, please. Okay, so our work and our overall impact goal is to increase vaccine confidence and improve vaccine uptake in refugee, immigrant, and migrant communities. And we do this by creating easily customizable and accessible toolkits. These can range from creating communications to increase awareness and confidence in the vaccine, or creating services to actually get people vaccinated. And in the next slide, you can see some of the examples of our work. The focus of this webinar will be on a tool called Net Judgment, designed to reach young people in your communities. But towards the end, we'll also talk about Mothers for Mothers, that is designed to help to increase vaccine uptake of the mothers from refugee, immigrant, and migrant communities. And then we'll also touch upon mixed space that you might use for building vaccine confidence a little bit more broadly. But without further ado, I'll pass it to Rudy to talk about No Judgement Toolkit.
Wonderful. Thank you so much, Ezgi. So as Ezgi said, I'll share a little bit about No Judgement. It's a toolkit that offers a multitude of resources for community-based organizations and individuals to help de-escalate the often polarized conversations that are taking place around COVID-19, specifically among young people. And to do this, we're providing trustworthy information on common vaccine concerns. And really, it's about creating judgment-free spaces and conversation strategies to engage young people. And we really wanted to make this more human-to-human experience. So the tools are designed to take into account the unique needs and concerns of young people belonging to refugee, immigrant, and migrant communities across the US. And we worked alongside youth who identify as from refugee, immigrant, and/or migrant communities to create and test all of these materials. So as Sarita said earlier, we did work with the International Rescue Committee's youth ambassadors in order to do this work. And after spending time talking with young people, one thing really became abundantly clear. So on the next slide, you'll see that the more we try to change someone's mind, the more that they actually became stuck in their thinking. And we heard that young people are really sick and tired of being shouted at, blamed, and shamed across the divide of their phone screens. And so working alongside IRC's youth ambassadors, we really heard the need to create these spaces for judgment-free conversations. And we heard that young people are more likely to shift their attitudes about the vaccine when offered face-to-face human connection. So offering listening and validation and offering support. And then on the next slide, you'll see that we actually then worked with a group of young people that we were calling our Youth Design Collective to help co-design some of the refinements of these tools. And we have a representative of the Youth Design Collective on the line today, Murali. So I'll pass it to her to introduce herself and share a bit about her experience.
Hi, everyone. I'm really excited to be here today. My name is Murali. I use she, her pronouns, and I'm currently a Master of Public Health student at the University of Minnesota Twin Cities. And being part of YDC has been one of my favorite experiences, actually. As a public health student in the Community Health Promotion Program, I found this collective to be a really creative and engaging approach to addressing health challenges. I also appreciated that IDEO and the NRCRIM took the time to develop this collective because it shows that they are invested in truly understanding the communities they want to reach and serve and increase the effectiveness of the work. This can be reflected in the tools we have collectively developed as they are more feasible and also sustainable. And honestly, these tools can be used beyond the COVID-19 vaccine. This collective really shows that multidisciplinary work is a strong approach to addressing health challenges.
Thanks, Murali. She'll be back online to tell us about more in depth about the tools. But in addition to working with young people, we also gathered feedback from community-based organizations who are serving young people, including Asian Media Access and Congolese Patriot, on how we might design these resources to be more easily adoptable and adaptable by community-based organizations. So from young people and community-based organizations, a few principles that surfaced on what these tools needed to be included that they needed to be culturally affirming. So these tools really take into account the specific needs of refugee, immigrant, and migrant young youth. For example, taking into account immigration status, families being part of this conversation around the vaccine, and the impact of their lived experience of coming from historically marginalized communities. The materials are also obviously youth focused. This was made for youth by youth. The tools were all edited and created together with the Youth Design Collective, as well as the youth ambassadors from IRC. These tools also are meant to honor multiple perspectives. So our hope is to engage everyone with various vaccine perspectives in conversations. And so to help shift these mindsets, we need tools that make everyone feel heard and validated. And finally, these tools are designed to be relevant and relatable. The tools adopt language that really speak to younger populations and normalize open conversations. So the language is intentionally casual, inclusive, and inviting. And with that, I'll just do a brief overview of all of the tools that are created on the next slide. You'll see that there really are an array, a suite of tools that you could use as an organization or as a young person who finds himself on this website. But we have a number of different tools that will go in depth on ways that you can spark conversations, practice conversations, and host gatherings. And the key insight on the next slide from prototyping all of these tools was that really the social risk of posting something sensitive and original on social media was really high. This is what we heard from young people. But if community-based organizations take that lead, young people are much more likely to repost and engage. So we took some time to develop tools that are both CBO facing as well as tools that face young people directly. So on the next slide, for CBOs, we've built tools that really help to broadcast and engage with young people in your community. And we have an array of tools to help spark and facilitate judgment-free conversations. Sorry, I should clarify, CBOs, by that I mean community-based organizations. I'll keep saying that, sorry about that. Thank you for pointing that out. We have an array of tools to help spark and facilitate those conversations. And then for tools facing young people, we have built tools to help young people learn how to have judgment-free conversations, watch examples, and help them practice themselves. So whether young people find their way to these tools through their organizations or on their own, there's really an array of resources to clarify doubts, practice conversations, and resources that are really shareable among their peers. So without further ado, I'll pass it to Murali to speak more about each of those tools in depth.
Okay, next slide, please. Perfect. So all the tools that we created are designed to engage with youth from RM communities in welcoming open and honest conversations about the COVID-19 vaccine through outlets and strategies that are popular among youth. So one of our tools to get the conversation started is the BuzzFeed quiz. And these types of quizzes are really popular among youth. And so they're really easy to share and is a creative way of engaging people to think about the pandemic and the vaccine. And the really strong point of this quiz is that it does not have a strong point of view that it's trying to push on people. So it can really be sent to anyone. It's just kind of to gauge what people's perspectives and thoughts are on the pandemic and be like, oh, what kind of pandemic personality do you have? And, people love to compare what they get and have conversations about it and be like, oh yeah, we're not so different after all, or we are kind of different, but that's still cool, So all these conversations with a BuzzFeed quiz are really popular, and people constantly share quizzes like these because everyone wants to know what their friend is like. So this is a really easy tool to get people to kind of just spark the conversation of oh, I didn't know that you kind of felt this way about the pandemic, how come? So just kind of a very creative way of being let's talk about this. And so next we have our social media posts, and these social media posts are designed for community-based organizations to share with your youth, your communities, and for your youth to share it with their networks to spark conversations. And so youth engage highly with social media, especially Instagram. And as a young person on Instagram, I can definitely verify this. And this is where we see things as a source of information and also as a way to connect with others and have conversations about what's trending in the world and what's happening locally, especially with a lot of human rights events and even the pandemic. I ran a university organization called Mask Up Yemen, and we had our own Instagram channel, and we kind of posted and shared information, and based on what we posted, I shared on my personal stories, and people would really engage with the material, ask me questions, really want to, get to know more. And I did it in a way that was kind of more hey, here's information. If you have any questions, feel free to reach out to me and I'm welcome to clarify anything. And so it was really effective and people were really engaging with information. And so these posts are essentially, coming from a community based source. They're to be a trusted invitation to kind of connect and start a conversation online. And so I'll hand it back to Riddhi to give a demonstration.
Thank you, Murali. I'll talk us through a little bit of how these tools exist online and where you can find them. So Murali is basically given us a deep dive on some of the tools, and all of the tools live on the No Judgement website. The No Judgement website is really organized around tools that are for individuals. So tools that can be facing youth directly, and so that young people can interact with directly, and then tools that can help organizations, be they community-based organizations or other types of public health actors, or really any sort of public health group. The tools here are meant to help everyone engage or help organizations direct people to the tools. So the two tools that Morali just talked about, first she talked about the quiz, and I'll just direct you to where you can find the quiz yourself. Here it is under organization. If you scroll down, you'll be able to see both the example BuzzFeed quiz that was created with the Youth Design Collective, and you can also see instructions for making your own quiz. Additionally, Morali was talking about social media posts, and we have a whole page on the No Judgement website organized around the social media posts. Essentially, we've organized the variety of posts and the variety of templates that we've created around the type of message that you might want to share. So here you'll see tools around sharing unifying messages. You'll see templates that we've created that have more space for more text if you want to share a longer story. You'll also see some examples of conversation starters, direct appeals, and then finally also announcements and invites. So these templates here at the bottom are specifically, say, if you are hosting an event, be it virtual or in person, around the COVID-19 vaccine, you can simply use these templates to customize and create your own. Let me show you how that works. So let's use, for example, the direct appeal. Once you click on the button, you'll be invited to use the template. And then once you say yes, you'll be taken to this document. Essentially, all of the tools that have been built, especially all of the social media posts, are using Google Suite. That means Google Documents, in this case, Google Slides. And the reason why we've selected this as a tool is because it's free for anyone to use. So all you need is a web browser. And so once you access the actual document, you'll see that creating your own social media posts is really as easy as picking a color palette, customizing the message, and then picking a channel to post it on. So for today, let's assume that I'm going to pick the yellow. Once I'm on the slide, I see that there's instructions in the margins that help me understand what to do. And in this case, the instructions are very simple. I can write my own message. And then, and then whenever I'm ready, I can simply hit download as a JPEG, and I have an image that's ready to post on social media. So that's where you can find those first two tools. And Morali, I believe you're still muted.
Oh, oops. Thank you, Claudia. Anyways, next we have some tools to help practice judgment-free conversations. So these tools are very much like hypothetical scenarios to help with concerns that their peers have, and are designed to help with help the person like validate and give information to help their peers and friends make a good decision for their own health. And so the first one we have are called info bites, and these are really specific to REM communities and are concerns or barriers they may face when accessing healthcare or making health decisions. So for example, systemic discrimination in healthcare, which is something that I'm very familiar with, or the logistical challenges of being undocumented and finding a way to receive the vaccine are also important challenges to address. So for each concern or topic, there are some pointers to guide the conversation in an open and welcoming way that is productive and helpful to the person who's facing this concern or challenge. And these pointers were really written simply by youth, and then especially for more medical information about like COVID itself in particular, or the vaccine, they were verified by physicians as well. And then another tool we have is called Textversation. And so this tool we actually got to test out in the YDC. And so with texting being common and sometimes preferred form of communication these days, especially among the youth population, this tool is helpful for guiding like online conversations. And it's an easy way to practice possible conversation responses when discussing the COVID-19 vaccine, especially with peers or friends who may be more aversive to it. So it's really an easy way to practice, and it gives you real-time feedback on how to have conversations that are validating, and non-judgmental, but also helpful. So it's really a tool where you can kind of simulate different scenarios and see like, oh, if I respond this way, what would be the possible response that I would get back? And kind of find the middle ground of, okay, this is a healthy way to respond to someone to make sure that I'm still recognizing what they're going through, but at the same time, I'm also trying to get them to think or consider some other alternatives to, maybe getting a vaccine or consider seeing COVID in a different way. And so it's a really helpful tool for just like individuals and also organizations, if they wish to use it, to really see how can these conversations flow out online. And I'll hand it back to Claudia for the demonstration of this.
Thank you, Marley. So again, I'll share where these tools sit in the No Judgement website. We'll share the link to the website shortly in the chat, but a couple of things to note: any of these tools are free and open source to use, so you can feel free to take them, to adapt them, to customize them. The tools that Marley was just highlighting were the tools that help young people practice judgment-free conversations. So those tools sit under individual, and under individual, you can see the info bites. There's also a lot of different concerns that that were highlighted during our research. And so there's actually a whole page dedicated to info bites, organized around logistical concerns, societal concerns, really making sure that we're highlighting and emphasizing some of the concerns that we heard specific to young people and specific to young people from refugee, immigrant, and migrant communities. One of the things that came up, of course, was around having conversations with family about the vaccine or making decisions with family. And so those are all of the things that are highlighted here. Additionally, Marley spoke about the text conversations, which are also on the individual page if you scroll all the way down. And basically the way this works, it's almost like a phone simulation where you can click and interact to have a conversation between two people, or to simulate a conversation between two people. For the sake of today, I'm just going to pull this up in a new tab so that it's, let me do that one more time so that it's much bigger and easier to read. But essentially, once you're in the text conversation tool, you can just click on Get Started. And what you'll see here is a sample conversation between two people. One of them is vaccine hesitant. And you're basically prompted between different options of how you could respond. For example, in this case, the person or the friend is asking, why should I get the vaccine? I'm really young. And you have a couple of options to respond. Perhaps let's select the option of inviting that person not to be so selfish. What you can see here is that the tool will then tell you or guide you, around how this response may not be the most judgment-free response, may not be the response that then invites that person to change their mind. And instead, it also suggests different things that you might say or might try instead. And so as you go through the tool, you'll be able to see, different various bits of conversation. You'll be able to see sample text that you could use to respond. And the tool basically is real-time practice for how you might have judgment-free conversations with others. Back to Marley.
Okay, I'm pretty sure I'm unmuted this time. So continuing the conversation on practicing conversations. So the next we have are the videos, which were my personal favorite to be a part of, since they really put my absent acting skills to the test, I should say. Anyways, these videos reflect how in-person conversations may flow and provide an opportunity to show how a healthy conversation can happen while navigating the challenges of talking about the COVID-19 vaccine. So they show how a person can actively listen to their friend, be open to understanding their friend, and also offer help and support to navigate their decisions. So these are just kind of like, oh, you're having a normal conversation, and then the topic of COVID-19 comes. What are some ways to go about discussing it, to like really listen to your friend, and also provide the support and assistance they need to make the best decision for themselves. And we have two different types of videos. We have one that's just one-on-one with the friend, and then we have another video where it's the friend the friends, and then also another person that they've called in to ask about information regarding COVID because they're an expert on COVID. And so there's a few different scenarios out there and different types of conversations that can flow, but really it's just to demonstrate how a real lifetime conversation in person can happen. And then we also have tips for judgment-free conversations. And those tips for judgment-free conversations are skills that we see are effective in daily conversations, and also community outreach that can allow people to feel heard and be comfortable to open up to share their perspectives and thoughts. And so these tips will allow trust to be built enough to have a difficult but helpful conversation that can help guide people to make the best decisions for their health. So these are really critical skills we see in communication, regardless of what is being discussed and when it's being discussed. It's critical for relationships that you have with, especially building trust among communities. And so really helpful tips for people doing outreach or just wanting to have these conversations. And once again, I'll hand it back to Claudia.
Thank you, Morali. So I'll just very quickly share where these tools live on the No Judgement website. So again, the tools that Morali was just highlighting were one, the videos that showcase people having judgment-free conversations. They're here under the individual page. You can also find different testimonials around why different members of the Youth Design Collective who were working on this project with us decided to get vaccinated. There's also all of these videos live on YouTube, so they're ready and easy to share. And then here as well on the individual page, you can find the tips that Morali was talking about that help youth consider how they might engage others in judgment-free ways. Oh, 1 second.
Okay, so lastly, we have 2 resources for hosting judgment-free conversations. So let's say you're all practiced up, you've sparked some conversations, now is the time to really deep dive into it. So these tools are mostly for community-based organizations, but can also be useful for other youth organizations and individuals as well. So the first tool is a gathering planning tool set, and this is for CBOs designed to help plan and execute a conversation. So whether this is happening at a place of worship or a community center, this guide is meant to really bring your community together and hold a space to have conversations that are built on trust and sense of belonging. So these are guides to how to create a planning team, figure out the logistics, and build an agenda. And so it's a whole whole tool set of ways to go about how to really, from the start to the finish, how can you build and execute this conversation. And then we also have another guide that's a troubleshooting guide. So this is really meant for those hosting conversations, whether online or in person. So this is really for the people doing the work. And this tool is designed to provide tips on how to navigate difficult conversations on COVID-19, which, as we all have come to know in this country, has become a very controversial and political topic. And so this is a resource where it's really designed to ensure, reassure, and protect the people who are doing this work. So as someone who took part in pandemic work these past years, I can say that it is really important for you to take care of yourself while doing this work. So I'll hand it back to Claudia again.
Thank you, Morali. And again, where do these tools live on the No Judgement site? They live under organization, and the whole idea about the organization page is that you can find different ideas about how to direct young people to interact with the tools directly. So if you scroll down, you'll be able to see the instructions, or basically access all of the assets for hosting a gathering with young people yourself. So here you'll see prompts to help you pick roles, prompts to help you plan a workshop, and then also to build your agenda, as well as all of the safety and troubleshooting guides. So we'll be sharing the link to the No Judgement site in the chat, so you can take a look at this yourself. We're very excited and invite you to explore the tools and to give us feedback, especially around how the tools are working for you and your communities. Before we break for Q&A, I did want to take a moment just to quickly share 2 other sets of toolkits that aren't necessarily specific to young people, but that have been created in this partnership between NRC Room and Ideaorg, and that exist out there, also available for you to explore. The first one is Makespace, which Sarita touched on earlier today. So Makespace is a customizable campaign. And we've included in the building of this campaign all sorts of images so that you can pick images that are relevant to your community. And the campaign is basically built under the principle of fill in the blank so that you can really land on messages that are hyper-specific, hyper-local, and really relevant. Under this Make Space and Vaccination Is campaign, there's a couple of different communication materials that you can access. There are, at the very top, at the level of engaging, there are posters and assets to build social media posts. Then additionally, if you want to go into more detail of informing, there are tools that help you create little fact sheets and inform the community around specific concerns. At the level 3 of reassuring, you'll find templates to build out actual comic strips that help you perhaps address very specific concerns that might exist in your community. And then at the 4th level, you'll be able to find assets that help to reinforce and celebrate vaccination. And we recognize that celebrating vaccination and maybe having a sticker that says I got vaccinated might be more relevant in some communities than others. So we definitely invite you to use these resources as an option. All of the tools related to the Vaccination Is campaign are built using the same kind of Google templates that you've seen before. So they're all built under the kind of principle of fill in the blank, drag and drop, copy, paste. We also have essentially 2 places that you can look for these resources. One is on NRC RIM's website. You can find the Vaccination Is campaign assets already translated into multiple languages. We've also created a separate resource called Makespace that helps you create a campaign of your own from beginning to end. So under Makespace, you'll also find different templates and checklists for creating a campaign from scratch for your community. Finally, there is Mothers for Mothers, and Mothers for Mothers was developed in partnership with a community-based organization in Atlanta called Refugee Women's Network. And this is a toolkit, so a set of tools for any organization to host a peer meetup for mothers to address a specific health topic. And so for mothers, this is a chance to, one, come together in community, which is something that we heard a lot about the immigrant experience sometimes being isolating. So this is an opportunity to come together in community, also to have a break from the labor of caregiving. And so in the toolkit, you'll find kind of checklists and indications around providing childcare. And most importantly, it is a chance for mothers to come together and address health concerns by learning from others with similar experiences. So in this toolkit, and we'll also drop a link to this in the chat, you'll find tools that are organized around 4 key moments. These 4 key moments are plan, promote, prepare, and present. So under planning, what you'll find are checklists, everything concerning logistics, thinking about rules of hosting a gathering. You'll even find a tool to help you build a budget and help you determine how much budget you might need to raise or set aside in order to have a Mothers for Mothers gathering. Under promote, the second moment, you'll find all sorts of tools that are easy to customize, all intended to help you promote this event in your community. So you'll find text that you can copy paste into any messaging app, be it WhatsApp or Facebook Messenger, Viber, to share news of the event. You'll also find a template for tracking RSVPs. You'll also find templates for creating printed or social media invites. Then under prepare, this is really for when you've already kind of figured out the logistics of the event and have invited people to the event, and then you're trying to think about what actually happened. So under prepare, we've created a set of sample agendas, a set of sample activities, even all the way down to example scripts for what you might say during a specific gathering. All of the assets under prepare are targeted around the COVID-19 vaccine. And then finally, under present, you'll find assets that are include, set of slides that you can easily project and use, as well as ideas about what to do as follow-up. So all of these tools are created for Mothers, and they exist on the link that we're dropping in the chat. Feel free to explore them and know that they're also out there and available for you to use. Finally, I'll just share that this event was built with RWN, and they have run it a number of times, both virtually and in person. It's been very successful. I think one thing that they've done, which is also something that we foresee happening with Mothers for Mothers, is that once you have a gathering around one particular health topic, it's possible to shift in the future. So the first couple of gatherings of Mothers for Mothers were all around the COVID-19 vaccine, but the most recent one they've had has been around nutrition and healthy eating during Ramadan. So no, these tools are also out there and available for use. And with that, I'll pass it back to Sarita, who will help us moderate some time for questions.
Thanks so much, Claudia. I hope everyone enjoyed hearing about No Judgment, Mothers for Mothers, and MakeSpace. I'll invite any questions that people have from the audience. We did get a couple questions in the chat that I just wanted to repeat here for those who may have missed them. One was, what was the age group that we were really focusing on for, like, who's the audience for No Judgment? And we worked with youth and young adults up to age 25. And so that we really focused on the young adult population. So just want to answer that one. And then we had somebody also ask about languages. And I'll start answering this, but I might ask Claudia, Riddhi, or Murali to chime in. And we have, like, in our Get Vaccinated, Get the Facts campaigns, those are available in more than 40 languages. Vaccination is in 11 languages. I think Mothers for Mothers is in maybe 12 different languages. But I know that No Judgment, all of the resources we have here are only available in English. And so I'll invite my other panelists to kind of speak to that a little bit.
I can chime in there, and would invite any of my colleagues in Murali to share more there. But I think one key thing that we heard, especially during the initial design phase of No Judgment, was that a lot of young people from refugee, immigrant, migrant communities were quite comfortable in English and were happy to have tools in English. I think places where they would have wanted tools to be translated into their preferred language would have been tools that they were sharing with adults in their community or in their family. And so I think for a lot of that, what's available on NRC RIM's website is great. But then I think also, just like what we heard primarily was that young people were excited about tools in English and was also their preferred language for most young people.
Thanks so much, Riddhi. I actually had a question for Murali. So if somebody only used one of these tools, like we went through a lot with the gatherings, with the text conversations, with the info bites, the social media. So if an organization could only use one of them, which do you think is the most valuable?
That's a very good question. Oh, that's so hard. I'm always into use a multi-level approach or a multi-approach kind of person. But I think personally, if there's anything that's probably really effective, is bringing, I think honestly, especially for a CBO, like community-based organization, I think the gathering planning tool, like how to host a conversation, would be very effective. Because I feel like in a lot of refugee, immigrant, migrant communities, sense of community is very important because we're all trying to hold on to our cultural identities and also trying to find a place where we feel like we can still remember what home is like or what our communities are like. And so I think honestly, the planning tool is one of the most effective because you're already utilizing space and places that exist, but just bringing people together to have an extra conversation on something that's really important, such as their health. So I would say probably that tool for me. And then otherwise, info bites. So yeah, that's how I'd answer this question, I guess.
Yeah, I'm sure people are really missing those in-person gatherings. And like you said, I mean, in person is great, but it could also be on Facebook Live or something like that. So I can see why you would say that those kinds of event planning documents might be most important. I guess I have a general question, and I invite others in the audience to add questions to the chat. as well. What value, Murali, do you think that youth voices add to a public health response?
Oh, that's a really good question. So I think it adds a lot of I feel like as an emerging professional and as an emerging leader in the field of public health, it's often very challenging to really say what we want for our future, because oftentimes the people making decisions on our behalf are not, I hate to say this, are not going to be alive for much longer than we are. And so I've worked at the health department. I'm part of an international organization that's also made up of a lot of emerging professionals. And what I've really noticed is that we are ready to change the systems we work in. We are really ready to break things apart and rebuild. And I think the hardest part is, we're in a phase in the world where like things are rapidly changing, but we're not really seeing them improve per se, like situations that we're a part of. And, I feel like as youth, we bring in a lot of new perspectives and we are really ready to challenge, like I said before, challenge what we are a part of. And I think, especially the way we learn, the way we interact with the world is just so different from, everyone else. I think it's just adding that new perspective. And what really frustrates me sometimes being a young person is I feel like, especially in public health, a lot of opportunities are not available to young people, but yet I feel like my future is being determined by someone who's not in my control or out of my control. So I think, really incorporating youth voices into anything that we're doing is really important, because at the end of the day, the youth is your future and you need a healthy youth if you want a future. And the way I see it is, the future starts in the present. And so we're sitting in it here right now. And so now is the time to really involve everyone and everyone, because people are always like, oh yeah, like when you get up there, like you'll make all these changes. And I'm like, no, I can't wait until I get into a position of so-called power to make these changes. I want to work with you right now where you're at and make these changes together. And so I kind of see any kind of work with youth being really collaborative, and not just being like, oh yeah, your future generation, you'll make lots of changes. It can't wait. It has to happen now. So that's kind of my ramble perspective on it.
I couldn't have said it better myself. Like, youth are our future and the future is right now. And like, why wait? Like, because there's so much wisdom and expertise that already exists that youth and young adults already hold. And so it's really the responsibility of organizations to elevate that voice and to lift that up. So I guess, what advice would you give to health departments or community organizations that want to engage young people in their community? Like, what advice do you have for them?
I think, for me, I really appreciated the team I worked at the health department. They really made sure that we were involved in a lot of different aspects of what we were seeing, what we were learning, and they're also open to like us being able to talk about the issues that we're seeing and kind of take that feedback and be like, okay, we will elevate it to our supervisor, or we'll elevate it to the health equity coordinator, or we'll elevate it to someone else. And so I think like being that bridge between where we cannot bring our voices up has been really helpful. And so just like honestly being a bridge and like bringing what youth populations are saying are their concerns, what they see for their future, what they want for us, like in the present moment. I think just really listening, taking the time to listen and be like, okay, I have a way, with the position of power that I'm in right now, I know how to take your concern and elevate it to the next level where we can actually take some action upon it. And for me, I feel like for large things, like people do listen sometimes, but they just fail to act upon it. And I know action isn't always possible, but even just, connecting with other people or trying to, like I said, elevate the concern is always a good start. So I think just being able to make that connection, but also being like, okay, what are some avenues we can collectively work together to take action to address what we're seeing now, to improve our community's health or to improve what we're seeing, is always important, I feel like.
Thank you so much. I'm gonna ask Claudia to we have like a QR code where you can scan it if you want to like get to all of our materials. So I'll ask her to put that on the screen. As I asked, we have 1 minute left. And so I'll just ask Riddhi and Claudia, like, is there anything that what is something that you learned from youth during this process? Like, is there anything that surprised you about work, any information they gave you that was just particularly notable?
One piece of one, I think, moment that sticks out for me is that when we were working with the Youth Design Collective, one of the members said that like, if we like are constantly blaring like like front and center on this no judgment page, this is for refugees, immigrants, and migrant youth, it might actually be a turnoff. And he was like, I don't want to be constantly reminded of how I might be like othered. And so I think that sort of translated into us like wanting to be conscious, and like I think he would say this too, like wanting to be conscious of like the specific concerns that refugee, immigrant, and migrant youth would have, but not making that the like super forefront and like making that like super blatant on the website. And so just trying to find that balance of, you know, reaching specific and unique concerns, but also making sure that it doesn't feel othering in the way that we're designing the materials.
Thanks so much. We're out of time. This has been a really great conversation, but I'll be sure to send an email out to all the participants this afternoon with links to everything that we discussed. Feel free to respond to that email if you think of any questions as we close out. So thank you so much.